fall is here, and that means the weeks are getting a little colder, and it might be time to switch up your skincare routine, especially with the weather changing, and it's going to change dramatically in the next few days. We have Dr. Melanie Palm here in studio with us to talk about skincare regimens and what to do and how to change it up. Nice to see you, Dr. Melanie. Good to see you. And so, yeah, I find myself doing this a lot.
Yes.
Do you find yourself doing this a lot?
Yeah, I found my puppies doing it too. Even our animals get affected by winter skin, and especially with the Santa Anas, there's not so much the drop in temperature. There's a little crispness in the air that I'm sure your viewers have been seeing, but it's the drop in humidity as well. So I think it's a good time to start talking about good skincare practices, so we're not doing this, not so itchy, don't feel like we have that dry, flaky skin as we go into fall and winter.
Now, you brought some ideas. Let's start over here because oftentimes you want to change things up. Let's say you've been using the same type of lotion or product or what have you, and it's no longer working, or you're feeling like it's not doing the trick.
Yeah, so I tell patients look for ingredients and look for formulation. So, you know, in the summertime, a gel might be great because it's hot and humid, but as we go into fall or winter, think about switching that gel or that lotion to a cream or even something ointment-based. So that is a really helpful tip. We know the thicker a formulation, the more occlusion it causes on the skin, and it's going to keep our native moisture in our skin secure, and it's not going to evaporate into the environment.
So you're saying this is more ointment based.
Yes, yeah.
So it's thicker.
Yeah, and at the very extreme end, people that have allergies to things, something like a Vaseline ointment or a petrolatum ointment is the best, but a little bit grimy. So we have gotten a little bit more elegant. The other thing I tell patients to look for is look at the ingredients. And so if you're somebody allergic or have problems with fragrances, the fewer the preservatives, the better. There is a line that dermatologists do recommend called Vanicream for everybody that's allergic to everything. But otherwise, over the counter, there's amazing products that now contain ceramides, free fatty acids, and hyaluronic acid. And ceramides are like sort of the cement between the bricks that are our skin cells. So it helps repair the skin barrier. And then free fatty acids and hyaluronic acid. Hyaluronic acid is such an important component in moisturizing our skin. So look for those three ingredients.
That's key, because oftentimes when we buy products, many of us don't even bother. We don't even bother looking at the back. And on the back of whatever product that you decide to buy, it should state it on there, right? On the back?
And don't forget about sunscreen. So you might change your formulation too and look for ones that actually have moisturizers in it, or something like green tea or vitamin E that can be a little soothing to the skin. So you have something that's kind of helping dry skin along the way.
You know, you made a very good point right now, is don't forget the sunscreen. It's San Diego, and whether we are in fall or winter, it's still sunny.
And I feel like our fall is our summer, right? We've had the most beautiful weather, so don't forget that. And if you are having problems, if you're up at night itching, if you're getting red patches on your skin and it's not getting better with over-the-counter measures, that might be the time to consider seeing a board-certified dermatologist. So we can help you with steroid and non-steroid topicals, and there's even oral medications and immunotherapy that's helping very severe cases of eczema.
You know, is there any possibility that something like, if you use too much of like the Vaseline, the ointment base, it could dry your skin out?
No, it doesn't. You know, and I think one of the things to do, you know, it used to be we thought, oh, you can't shower too readily with eczema-prone patients. Water is great, showers are great, just make sure it's not too hot and make sure you're locking in that moisture afterwards. So water is awesome, we just don't want to lose that retention in the skin. So no, if your skin's feeling tight, if it's feeling a little dry, it needs some repair, it's not making enough of what we call natural moisturizing factor, which is an actual thing in skin science, and you need to help it along with some of these products.
Can I take advantage of your expertise and ask you, my son has really dry legs. And he constantly does he just doesn't want to use lotion, and I struggle with him all the time. What would you suggest? I mean, is there a certain type of, should I be going more towards the ointment, the thicker
formulations? And there's really nice ones that are pound jars, so it's easy to apply. I tell patients just put it in the shower, so when you're actually done with the shower, towel off, your skin's a little moist.
I feel like a broken record. I'm like, don't forget the lotion. But
it's really important to set this. You know, his skin is a little different than everybody else's. And the lower legs, they heal the slowest. They tend to be the driest. It's a hard
They get
area
the
to treat.
ashiest too.
Yes,
I mean, it's
know.
like, oh my goodness. Thank you for that advice,
Yeah,
by the way.
absolutely.
This is great. Okay, and don't forget the sunscreen. I mean, Dr. Melanie brought in some examples, but there's so many different products.
Yeah.
And the main thing, as you mentioned, was the key ingredients. Look
Yeah.
for those 3 ingredients.
Yeah.
Of course, always a pleasure to see you.
Thank you, Liz.
Thank you so much. All right, have a great day.
You too.